Okay, just waiting for people to come in. And we'll start very shortly. All right, I think we can make a start. Hello, everybody. Thank you for coming to the webinar on From Research to Translation, Cardiovascular Health Mission. I'd like to begin by acknowledging the traditional owners of the land on which we meet today. The Department of Health, Disability and Aging that's running this webinar is located on Ngunnawal land in Canberra. I greet you from Noongar land, that is Perth, and our speakers also meet you today from the lands of the Wurundjeri, Woiwurrung and Bunurong Wurrung, that is Melbourne, and Wadawurrung, that is Geelong peoples. I'd also like to pay my respects to elders past and present. So the purpose of today's webinar is to tell you about the Medical Research Future Fund, or the MRFF's Cardiovascular Health Mission, its priorities, impacts and opportunities, which we'll cover in the first half. In the second half of the hour, we also hope to draw better connections between research and its translation into real-world policy and outcomes, and specifically provide examples where research has helped address government priorities in cardiovascular health and stroke. My name is Cindy Tamrin. I am one of the principal research scientists and directors within the Health and Medical Research Office within the Department of Health, Disability and Aging, and this is also the office that administers the MRFF. And joining me today, I'm very happy to introduce our four speakers. We have Dr. Corinne Anglem and Dr. Marion Stewart, who will be speaking in the first hour. They're also from the Health and Medical Research Office. We are joined by our colleagues within the Department of Health. Then that is Deanna Wilgren and Ian Edwards from the Cancer, Hearing and Chronic Conditions Divisions, which has oversight of cardiovascular health policy and projects within the department. All four speakers will stay on until the end of the webinar, and there'll be allocated time in the last 10 minutes of this hour for Q&A. So as the webinar progresses, please do post your questions to the Q&A section on your Teams window. It will be moderated. We will try our best to answer what we can, as well as prioritize those that have the most votes. But if we don't get to all of them today, we will leave up contact details should there be any further questions. So without further ado, let's begin. So as I said in the first half, Dr. Corinne Anglem will tell you about the Cardiovascular Health Mission under the MRFF, its priorities, as well as details about a currently open grant opportunity. And after that, you'll hear from Dr. Marion Stewart, who will speak on the outcomes of a recent review into the mission, impacts, and opportunities for improvement. All right, without further ado, over to you, Corinne.
Thanks, Cindy, and good afternoon, everyone. I'm Corinne Anglem, and I'm an Assistant Director in the Mission Strategy and Implementation section in the Health and Medical Research Office, where I look after the Cardiovascular Health Mission. So today I'll be talking to you about MRFF research missions in general, the Cardiovascular Health Mission, and the grant opportunity that's currently open under the mission. The MRFF was established in 2015 and is a $22 billion long-term investment fund, the proceeds of which currently fund approximately $650 million each year in grants for medical research and medical innovation. The MRFF provides a long-term, sustainable source of funding that aims to improve health outcomes, quality of life, and health system sustainability. The MRFF is a priority-led and responsive health and medical research funding program delivered from the Health and Medical Research Office in the Department of Health, Disability and Aging. The MRFF was designed to address strategic national health priorities, which are developed by the independent Australian Medical Research Advisory Board following extensive national public consultation. The third 10-year investment plan for the MRFF provides funding for 22 initiatives between 2024 and 2033 to support life-saving research, create jobs, strengthen the local industry base for commercialising research and innovation, and further grow Australia's reputation as a world leader in medical research. Developing new drugs, devices, treatments, and cures can take more than a decade, and the third 10-year plan gives researchers and industry certainty and direction so that they can address areas of unmet need and excel in collaborative and transformative research. So, what are MRFF research missions? Missions are large programs of work with ambitious objectives that are only possible through significant investment, leadership, and collaboration. Missions tackle significant health challenges by bringing together researchers, health professionals, stakeholders, industry partners, and consumers. This joint effort supports the discovery of new techniques and treatments that ultimately leads to healthier Australians. An expert advisory panel is established for each mission to advise the Minister for Health on the priority areas for research investment. This advice is provided in a roadmap and implementation plan for each mission. These documents guide funding decisions for each mission. The roadmap is a high-level strategic document that includes the aim, vision, goal, and priorities for investment for the mission. The implementation plan details the research required to achieve the goal of the mission and how this will be evaluated. Once drafted by the expert advisory panel, the implementation plan and roadmap then undergo national public consultation prior to their publication. Now we'll look at the Cardiovascular Health Mission specifically. This mission will provide $220 million over 10 years to make transformative improvements in cardiovascular health and stroke for all Australians. The mission aims to achieve this goal through reducing the number of Australians of all ages affected by heart disease and stroke, improving outcomes from acute cardiovascular and stroke events, and improving long-term recovery and survivorship after cardiovascular or stroke events. As you can see here, a timeline of the mission. It commenced in 2019, and in 2023, the department, in conjunction with the Australian Cardiovascular Alliance, hosted a Cardiovascular Health Mission Showcase, which was a wonderful collaborative forum to celebrate and present mission-funded research. At around the midpoint of the mission, an external provider was engaged to conduct a review of the mission, which my colleague Merrin will discuss in more detail next. The 2025 grant opportunity is currently open, and the mission will run until 2028. The extension of the mission beyond this time will be subject to evaluation. To date, the mission has invested around $160 million out of the total $220 million in 102 separate grants. While there are many excellent and important projects funded by the mission, and due to time restraints on this presentation, I have selected 2 projects to highlight here. First, we have an example of a project with good translational outcomes. The project is entitled Development of Drugs to Prevent Ischemic Injuries of the Heart and Brain, and has developed new drugs aimed at preventing injuries caused by heart attacks. It was funded under Stream 2 of the 2020 grant opportunity. This work has led to the formation of an Australian biotech company, Infenza Bioscience. The second project I wanted to highlight is a good example of partnership and co-funding with the MRFF, in which MRFF funds have been leveraged to inject further funding into cardiovascular health research. The strategic research grant was awarded to the Heart Foundation. The MRFF provided $4 million to the Heart Foundation, and the Heart Foundation then co-contributed another $4 million. The total $8 million was then used by the Heart Foundation to administer their strategic grants program. 8 separate grants were then awarded by the Heart Foundation, and you can see the names of those grants here. The topics covered by these grants include cardio-oncology, predictive modelling, secondary prevention, and women and heart disease. As articulated in the mission's roadmap, the goal of the mission is to make transformative improvements in cardiovascular health and stroke management for all Australians by the 3 aims that I mentioned previously and as listed here. The implementation plan specifies how investments should be made to achieve these aims by listing top-level priority areas for investment, as can be seen here, as well as more detailed guidance for investment for each priority area throughout the implementation plan. We use this guidance to design the grant opportunities for the mission, and so this document is a valuable tool for researchers to see what future calls for research under the mission will be for, and to plan their research accordingly. You can access both the roadmap and the implementation plan on the Cardiovascular Health Mission website via this QR code. Appendix A to the implementation plan lists all projects funded to date and maps these to the priorities for investment as listed in the implementation plan. This allows stakeholders to see how the mission is tracking against its short, medium and long-term priorities and to see which priorities have already been funded. Appendix A is available alongside the mission roadmap and implementation plan on the Cardiovascular Health Mission website and can be accessed via this QR code. It will be updated with the latest grant opportunity outcomes soon. So moving on to the currently open grant opportunity. The 2025 Cardiovascular Health Grant Opportunity is currently open. The minimum data for this grant opportunity is due by the 16th of July, and the final date for applications is the 13th of August, 2025. Stream 1 of this grant opportunity addresses Priority Area 1.2 of the implementation plan, which is to identify best practice preventative care for all Australians through novel diagnostic, therapeutic and health service delivery strategies. Stream 1 focuses on the health of First Nations peoples. Applicants to this stream should propose research that looks at prevention of cardiovascular disease and stroke for Aboriginal and/or Torres Strait Islander people using co-designed methods. The maximum funding available for a single grant in this stream is $2 million. The maximum grant period is 5 years, and up to 15 chief investigators and 15 associate investigators can be listed on an application to this stream. Stream 2 addresses Priority Area 2.2, which is discovering new solutions through innovation, including technology, drugs, devices, and models of care. Applications to Stream 2 should propose Phase 1 and/or Phase 2 clinical trials for novel devices or therapeutic approaches for cardiovascular disease and stroke. The maximum funding available for a single grant in this stream is $3 million. The maximum grant period is 7 years, and up to 15 chief investigators and 15 associate investigators can be listed on applications to this stream. Stream 3 addresses Priority Area 3.2, which is developing new treatments for recovery with better understanding of the biology of recovery, leading to improved monitoring and new treatments. Applications to Stream 3 should propose research involving large-scale multi-omic projects to improve understanding of recovery and phenotypes in cardiovascular disease and stroke. For a single grant, the minimum funding available is $3 million and the maximum available is $5 million. So this is the only stream in this grant opportunity that has a minimum funding amount. The maximum grant period is 7 years. And in contrast to other streams, in this grant opportunity, applications to Stream 3 can list up to 50 chief investigators and 50 associate investigators. This is intended to support large-scale, multidisciplinary and collaborative projects. And Stream 4 is the final stream of this grant opportunity. Like Stream 1, it addresses Priority Area 1.2. Applications to Stream 4 should propose research that looks at more effective preventative health interventions by either developing new therapeutics or technologies, discovering and developing new markers to improve risk prediction, or developing new approaches to tailor preventative care, support adherence, and reduce inequalities. The maximum funding available for a single grant in this stream is $3 million. The maximum grant period is 5 years, and up to 15 CIs and 15 AIs can be listed on applications for this stream. When preparing your application, it's important to consider the objectives of the grant opportunity against the assessment criteria. As indicated earlier, the MRFF is a priority-led fund, and each grant opportunity and each stream is different. So please read the detail provided in the grant guidelines, specifically section 2.3. The MRFF requires researchers to identify how their project will contribute to the MRFF measures of success, and the MRFF includes outcomes-focused assessment criteria. The outcomes of your research should be focused on real-world impact and should articulate how the impacts and benefits of your research will continue beyond the research period. The specifics, of course, will depend upon the type of research you're proposing, but examples include a plan to engage the Health Technology Assessment Team in the Department of Health for new therapeutics or devices, engaging with the relevant cardiovascular health policy team in the department with a view of incorporating your research findings into the department's policy on cardiovascular health, or perhaps impacting or amending best practice standard of care guidelines based on your research findings. And finally, I wanted to briefly touch on consumer involvement in MRFF-funded research. The MRFF's Consumer Reference Panel developed the Principles for Consumer Involvement in Research funded by the MRFF to strengthen consumer engagement throughout the grant lifecycle. All grant opportunities require a consumer involvement statement in which applicants describe the involvement of consumers at all stages of the proposed research, including its prioritisation, design, conduct, dissemination, translation, and evaluation. Consistent with the principles, researchers may request funding for the reasonable cost of supporting consumers and their involvement, consulting with consumers, and appropriately compensating consumers for their time and contribution. Section 7.4 and 6.3 of the Grant Opportunity Guidelines contain more information on consumer involvement and the Consumer Involvement Statement. So that concludes what I wanted to share with you about the Cardiovascular Health Mission and the grant opportunity that's currently open. We'll have a Q&A session at the end of all the presentations, but feel free to add any questions you may have to the Q&A function in this Teams meeting. I will now hand over to Merrin to tell you about the review of the mission.
Thank you, Corinne. So hello, everybody. I'm Merrin Stewart. I'm from the Performance and Evaluation section within the Health and Medical Research Office, and I'm going to take you through the findings from a recent review into the Cardiovascular Health Mission. So the Performance and Evaluation section is the area with responsibility for review and evaluations of MRFF programs, and we do this in accordance with the Monitoring, Evaluation and Learning Strategy. The strategy outlines that missions are reviewed or evaluated at their midpoint and in a way that's proportionate with the program or activity. So, for example, the size and complexity of the mission. So obviously today I'm talking to you about a recent midterm review of the Cardiovascular Health Mission, and I'm going to shorten this to CVHM when I'm speaking. So the review was undertaken last year, and it covered investments from inception of the MRFF to February 2024. In scope for the review are all MRFF cardiovascular disease and stroke research investments over this time period, with a total funding of $441.7 million. And this includes 85 grants funded through the CVHM, and they're shown in pink on the pie graph here. And then it also includes other MRFF investments in cardiovascular disease and stroke research funded through other MRFF initiatives. And this was 87 grants, and they're shown in blue here and are referred to in the slides as non-mission or non-CVHM grants. I just wanted to share two examples of non-CVHM grants for a bit of context. And so one is the Artificial Heart Frontiers program, and it is funded through the Frontier Health and Medical Research Initiative. And the other is the MTP Connect Diabetes and Cardiovascular Accelerator Initiative, which is funded through the Preventative and Public Health Research Initiative. I just have sort of two notes, I suppose. So one's on terminology. So the terms CVHM and mission are used interchangeably on the slides, but when I'm speaking, I'll use CVHM. And just on scope, the 85 grants here that are funded through the CVHM did not include those funded under the 2023 and 2024 grant opportunities, as those outcomes weren't available when the review commenced. So looking at the questions that the review was answering, the first was around how the MRFF has contributed to cardiovascular disease and stroke research in Australia. The second was around how the research we fund sits within the national and international funding landscape. The third was around alignment and progress of the research against objectives and benchmarks, and I'll talk to those on the next slide. And the fourth was around opportunities to enhance MRFF funding and granting arrangements to improve the impact of the research. The review was conducted by an independent contractor, policy by proxy, and guided by a mission review panel who oversaw the review. They advised on collection, analysis, and interpretation of data. So just back to that review question 3, when we talk about alignment and progress towards benchmarks, we look at two different levels, at MRFF and also mission, or in this instance, CVHM level. So on the left here is the conceptual framework for monitoring and evaluation of the MRFF, and it outlines the broader vision and aims, the impact measures, which are in blue, and the MRFF measures of success. You may be familiar with this figure. So when we're considering progress towards MRFF benchmarks, we're looking at these measures of success. And then when we're considering progress and alignments towards CVHM benchmarks, we're considering the aims, priorities and evaluation measures of the CVHM. And they're shown on the right there. I didn't include the evaluation measures because it would have been too much, but they can be found in the implementation plan. So in terms of inputs into the review, the department holds data on expenditure on cardiovascular and stroke research. So for example, funding by state or territory of the admin org, by priority area, etc. We also have documentation such as progress and final reports, and these were also an input into the review. Policy by Proxy undertook a grantee and stakeholder survey where the lead CI and stakeholders were asked about their views on the mission and lead CIs about their funded projects and progress towards objectives. Grantees have also been asked previously about outcomes and impact of their research via a separate performance indicators survey, and relevant data was also an input into this review. I'd just like to take this opportunity, if there are grantees in the audience today, to thank you to all of you who completed those surveys. It does provide important information for us about the CVHM and also the MRFF more broadly. Policy by Proxy also undertook interviews with a number of different stakeholders, and these were broadly classified into 4 groups, and I've just provided some example organisations there so you can see, but the full list is provided in the review report. And finally, the department undertook a review of national and international funders in the cardiovascular and stroke research landscape to identify key learnings and opportunities for the remainder of the mission. So I want to spend the remainder of time with you today taking you through an overview of the review findings, and obviously more details can be found in the report. So in relation to the first question, the MRFF contribution, many review participants believe the mission had positioned Australia as a leader in and elevated the importance of cardiovascular disease and stroke research and helped direct the research effort in Australia. In addition to the $441.7 million invested by the MRFF, funded projects leveraged an additional $145 million in cash and in-kind investments and led to $109 million of new funding. As shown in figure 8 here from the report, over 70% of projects reported that translation-related research was the primary focus of their funded project. Now looking at review question 2, MRFF positioning in the funding landscape. As shown in table 22 here, the MRFF is the second highest funder nationally behind the National Health and Medical Research Council, and that the MRFF has a higher average grant size, so 1.4 million for grants funded through the mission, or the CVHM, and 3.7 million for non-CVHM grants. Just that 3.7 million is skewed by a couple of large grants funded outside the CVHM. Still with review question 2, the review found that CVHM priorities are consistent with national and international cardiovascular and stroke peak bodies. They overlap significantly with the NH and MRC health priorities and are also broadly aligned with international funders with similar scope. The characteristics of other funders included a broader range of priority populations, formal co-funding partnerships, comprehensive support for EMCRs and clinician researchers, and strong support for integration of research into workforce and infrastructure. So these are findings that the CVHM could consider, noting also that some may be addressed by other MRFF initiatives. The review found that MRFF facilitates translation, particularly via commercialisation-focused grant programs outside the CVHM, and I've listed some on the slide and have also mentioned some earlier. When compared to other similar funders, the MRFF has a more comprehensive approach to consumer engagement throughout all stages of research, and some examples of where consumers are involved are listed here on the slide. So for review question 3, I've got a few slides on this, and the first one is looking at alignment of funded research. So the review found that all projects aligned with the grant opportunity under which they were funded, and that all 7 CVHM priorities have been funded, and the percentage of funding is provided there in Table 12. Review participants had mixed views on whether the mission priorities are appropriate, too broad or too narrow. Being too broad or having so many objectives was seen as less likely to be impactful. 56% of survey respondents and many of the stakeholders believed there were emerging priority areas of research. Some examples were basic and discovery research, primary and secondary prevention, and screening and diagnosis. The review did note that many of the emerging priority areas identified could be addressed under existing CVHM priorities. So now looking at progress of funded research against the CVHM benchmarks. So at the time of review, only 12% of the projects were completed and 27% were less than halfway through their funding period. Between a quarter and a third of the projects reported achieving all project milestones due at the time of their progress or final report, with the main reasons for delays being COVID-19 related issues, time for ethics or site-specific approvals, and delays in staff recruitment. As shown in figure 13 on the slide, for 23% of projects, chief investigators reported that they had met or made substantial progress towards the mission funding objective with which they considered their project most closely aligned. For most projects, demonstrable impact on the CVHM aims was not yet applicable, which does align with the stage of completion of most projects. So now looking at progress of funded research against the MRFF benchmarks, the measures of success, 86% of chief investigators and 59% of stakeholders believed that the CVHM and the MRFF more broadly had identified and addressed evidence gaps within their area of research. While there were differences in opinion about how well the CVHM has addressed priority populations, there was strong support to continue to prioritise First Nations health research. For the grants in scope, 90 clinical trials were funded with approximately 45,000 planned enrolments. As shown in the table here, MRFF funding for cardiovascular disease and stroke research supported 701 people in research roles, and this included EMCRs, those from cold communities, those living in regional, rural and remote areas, and those that identify as First Nations Australians. And most chief investigators believe that the CVHM has built research capability and supported the attraction and retention of talent. So still looking at progress towards the MRFF measures of success, 19% of projects reported impacts on providers' experience of delivering healthcare. As I mentioned previously, impacts on cardiovascular disease and stroke healthcare are not yet applicable for most projects. However, many of the projects have implemented activities to support the translation of their research findings into practice. So this included engaging with clinicians and engaging with partners who can change practice. Many grantees and interviewees raise the challenges of translating outcomes of successful research into practice. When looking at consumer and community engagement, most funded projects have used strategies to involve consumers, with involvement in co-design, on advisory groups and in governance being the most common type of engagement, as shown in the figure on the slide. And finally, 14 projects reported outputs related to commercialisation, including patents and new products entering the market. So now when we're looking at review question 4, what opportunities are there to enhance MRFF funding and granting arrangements? The review identified 5 opportunities for the CVHM to consider. The first was around refining funding objectives for the next 5 years with realistic expectations on what can be achieved within funded project timeframes. The second was around better supporting transformative research, and 2 opportunities were quarantining some CVHM funding for 1 or 2 larger programs of work, and or exploring ways to foster or provide support for funded research teams, particularly in relation to translation. The review also identified the opportunity to strengthen the CVHM focus on First Nations research and determine whether an explicit focus on other priority populations is warranted. The fourth was around better support for translation and increasing capacity and capability by strengthening requirements for translation plans in applications, involvement and level of involvement of EMCRs, and co-funding by grant recipients and or partners. And lastly, enhancing sector-wide coordination and communication about the achievements of the CVHM. So the outcomes from this review will be used by the department to inform future funding arrangements for cardiovascular disease and stroke research alongside the existing CVHM implementation plan. One thing that has come through in the review and we've already started implementing is increasing the funding amount and duration available to individual grants, and outcomes will also inform the MRFF more broadly. So I'd like to leave you with this list of recent and current review activities, and it includes a link to the CVHM review. As Corinne mentioned, we will have a Q&A session at the end of the webinar, so please feel free to pop any questions you may have in there now. And if there are further questions relating to the MRFF, please send them to their email address on the screen. Thank you.
Thanks very much, Marion. Well, you've heard now from the Health and Medical Research Office about the research that we fund by the MRFF and the Cardiovascular Health Mission. And now we're going to switch gears for the next half of the webinar. And we're going to look at how research has helped address government priorities in cardiovascular health, or has been translated or informed government initiatives. So in the next two speakers, Deanna Wiltgren will speak to you about the National Strategic Framework for Chronic Conditions, REFRESH, and associated National Strategic Action Plans. And following Deanna's talk, you'll hear from Ian Edwards, who will speak about current government initiatives funded under the National Strategic Action Plan for Heart Disease and Stroke, and the role that research has played. So I'm going to hand over to Deanna now. Thank you very much.
Good afternoon, everyone. As mentioned, my name is Deanna Wiltgren. I'm an Assistant Director in the Cancer, Hearing and Chronic Conditions Division, and my team is leading the refresh of the National Strategic Framework for Chronic Conditions. Today, I'll start my presentation by providing some context to chronic conditions in Australia, and I'll also talk a little bit about the need for the refresh of the framework. We'll then discuss how data and research has informed the refresh of the framework, and I'll finish off by letting you know about the next steps for the refresh of the framework, including when you can expect to be able to access it. So by way of context, chronic conditions continue to be the leading cause of illness, disability and death in Australia. Chronic conditions are becoming more prevalent as our population grows. Chronic conditions are attributed to around 90% of non-fatal burden and 78% of fatal burden of disease. 90% of all deaths in 2022 had chronic conditions as an underlying or associated cause. With a population who are living longer, the burden of chronic conditions continues to grow. Without appropriate supports and care, people with chronic conditions can experience challenges such as deterioration of health, loss of independence, social isolation, discrimination, stigma, disability and mental health issues, and overall lower quality of life, amongst other things. Priority populations experience disproportionately higher burden of disease compared to the general population, often due to determinants of health, which includes factors like family, social support, education, culture, income, access to housing and services, systemic racism and discrimination, and impacts of climate change. Most of the determinants of health are outside the control of individuals and even the healthcare system, which highlights the importance of cross-sectoral collaboration to improve health of all people living in Australia, particularly priority populations. So why do we need to refresh the National Strategic Framework for Chronic Conditions? The framework was endorsed by the Commonwealth and State and Territory governments in 2017 to provide overarching policy guidance for the prevention and management of chronic conditions in Australia. The timeframe of the current framework is for 8 years, from 2017 to 2025. The framework enables all levels of government and health professionals to work towards the delivery of more effective and coordinated national approach to chronic conditions. This aims to improve the health and well-being of individuals and deliver a more sustainable health system. The refresh of the framework will support its repositioning and its realignment with primary care reforms and guide sustainable evidence-based support for chronic conditions into the future. This work will directly support prevention policy and programs linked to a number of strategies, including, but not limited to, the National Women's Health Strategy, the Men's Health Strategy, the National Health Reform Agreement, implementation of the National Preventative Health Strategy, and the National Obesity Strategy. Following publication of the current framework back in 2017, chronic condition-specific action plans and strategies were published. The action plans and strategies were developed by healthcare organisations, professional bodies, advocacy groups, clinicians, academics and researchers, as well as patients, carers and their families, and were designed for their collective implementation and use. These action plans and strategies all share significant commonalities in priorities, which will reflect the refreshed framework's focus areas. Which will be reflected in the refreshed framework's priority areas. The refreshed framework has been informed by findings of an independent review of the achievements and lessons learned implementing the current framework and its associated action plans and strategies, ongoing engagement and collaboration with state and territory health working group representatives throughout the review and refresh process, a literature review, outcomes of the open public consultation submission process. The independent review of the current framework and its associated action plans and strategies included a targeted consultation process with approximately 40 external stakeholder groups. The final report provided recommendations for the development of the refreshed framework in response to the following questions. What difference is the current framework making? How effective has the implementation of the current framework been, and what can we learn from it? And what difference are the action plans and strategies making? The review also provided opportunity to identify common priorities and actions across the action plans and strategies. The summary of this report is available on the department's website for anyone interested. The department has been working closely with its state and territory health department representatives throughout the review and refresh process on the alignment on jurisdictional policy initiatives. A literature review was also undertaken to identify relevant domestic and international policies, strategies, plans, and emerging evidence on the prevention of chronic conditions and care, as well as management for people with chronic conditions. So we're looking at the period from 2017 to current date. The department also received over 400 survey responses to an open public consultation process on the refresh of the framework in early 2024. The open public consultation gave an opportunity for stakeholders to provide feedback on some of the enablers and barriers of the framework and their experiences living with chronic conditions, as well as any improvements that could be made. Now, we often get a lot of questions on the outcomes of the open public consultation, so I'll provide a quick summary of the findings. Submissions were received from a variety of stakeholders, including consumers, carers, organisations, advocates, government organisations, and academics and researchers, amongst others. Some of the key findings of the open public consultation included that submitters wanted to see themselves reflected in the refreshed framework, Responses highlighted the complex interplay between the determinants of health, priority population groups, and importance of intersectionality as it impacts chronic conditions experience. Stakeholders would also like guidance in the refreshed framework on how the different stakeholder groups can use the framework. 83% of respondents supported embedding common aspects of action plans in the refreshed framework, and 91% of respondents supported proposed focus areas for the framework, including providing integrated, person-centered, and multidisciplinary care, supporting multimorbidity and continuity of care across the life stages of a condition, enhanced and targeted support for priority populations, and embedding and prevention and early intervention in the continuum of care. So what's next for the refresh of the framework? Given the high prevalence of chronic conditions in Australia, particularly in priority population groups, and the wide variety of chronic conditions that affects people living in Australia, the refreshed framework will seek to prioritise guidance into areas that may provide common benefits across more than one chronic condition. Prevention will remain a focus for the framework, recognising and building upon the National Preventative Health Strategy. The refreshed framework will continue to provide evidence-based guidance for developing strategies, plans, and activities to address challenges associated with chronic conditions. The framework will continue to be primarily directed at government decision makers and as well as policy makers at the national, state, and local levels, with a view to enabling all levels of government to work towards providing coordinated leadership in the delivery of more effective and collaborative approaches to the prevention, early detection and intervention, care and management of chronic conditions. When available, the refreshed framework should be read in partnership with other related policies, plans, and strategies, including the National Preventative Health Strategy. Non-government stakeholders can use the framework to assist in understanding issues related to chronic conditions and the type of guidance that is informing policy decision makers. So when can you expect to see the refreshed framework? My team is currently working really hard to finalise the drafting of the content for the refreshed framework for the National Strategic Framework for Chronic Conditions. Following this process, we'll undertake what's known as an endorsement process for the refreshed framework, and once we get the okay to proceed, we will look to publish the framework. At the moment, we're aiming for the final quarter of 2025. Okay, so I know that I've gone through a lot of information in a very short period of time, so I appreciate your attention. If you would like to be informed on the next steps for the refresh of the framework, including when it is published, feel free to send us an email to chronicdiseasepolicy@health.gov.au. Otherwise, I will pass you on to my colleague, Ian Edwards.
Excellent. Thanks very much, Gianna. So hi, everyone. Thank you for your time. My name's Ian Edwards. I'm one of the assistant directors in the Cancer, Hearing and Chronic Conditions Division. So currently in the Chronic Condition Projects team, we manage a number of grants which are supporting the Australian community through research, consumer awareness, and also GP training and education, as well as cardiovascular disease and stroke. Our branch also looks after conditions related to diabetes, kidney, eye, liver, hemochromatosis, rare diseases, chronic pain, migraine, lipedema, and arthritis. So today I just wanted to provide the audience with a bit of an update and a bit of a picture of some of the initiatives that are supported by research and awareness into cardiovascular disease. So one of the action plans is the National Strategic Action Plan for Heart Disease and Stroke. So this plan was developed in conjunction with the National Heart Foundation of Australia and also the National Stroke Foundation. Currently, there are more than 4 million Australians that are living with cardiovascular disease, including heart disease and stroke. And each year, nearly 45,000 Australians will unfortunately die from cardiovascular disease. So the goal of the National Strategic Action Plan is that all Australians live healthier lives through effective prevention, treatment and management of heart disease and stroke. So as you can see on the screen there, the 4 priority areas linked to this specific action plan are prevention and early detection, diagnosis and treatment, support and care, and also research. So this action plan is available on the department's website as well, along with the other action plans that Diana showed in her presentation as well. So I just wanted to kind of talk through a few of the major initiatives that are working towards some of the objectives of that action plan. So the Australian government wants to ensure people get the healthcare they need and obviously when they need it. And with stroke specifically, time is of the essence. If you have had a stroke, getting the right care quickly can make all the difference between a good recovery and an ongoing disability. So this is why we're providing $15 million to the Australian Stroke Alliance for the advanced training and equipment so paramedics and neurologists can work together with hospitals to provide rapid stroke care. The intended outcomes of this program is to support effective prevention and management of chronic conditions to reduce long-term costs for the health system and increase participation in education and also employment. So also linked to this Golden Stroke Hour program and project, I just wanted to let you know that the Golden Stroke Hour project has received funding to the amount of $41.2 million via the MRFF Frontier Health and Medical Research Initiative. First in 2018, when the Australian Stroke Alliance and associated project committees and the councils were established, and then again in 2020 to develop the planned pre-hospital technologies to improve treatments in that critical first golden hour after stroke. And you also may be interested to know that the Australian Living Guidelines for Stroke Management were developed by the National Stroke Foundation with the support of MRFF to the value of $1.5 million in 2018. So some other initiatives that I'd like to go through as well, just to touch on. So the Heart Foundation, Stroke Foundation, Her Heart, and also the Australian General Practice Accreditation Limited. So with the Heart Foundation, funding has been provided to support recovery through the Mind CVD program. There's also early detection awareness programs through heart disease and stroke early detection. The Stroke Foundation, we're also promoting awareness and early detection through the FAST message, which is the face, arm, speech and time method. And the stroke are also being funded for the Living Well After Stroke, which provides support and evidence-based intervention for people recovering from stroke and also supports carers going through that process as well. Her Heart is another organisation that we're working really closely with, and that improves the education and treatment of heart disease in women through the Her Heart Hub. So the Her Heart Hub is a digital platform that has resources and connections to providers and specialists that can help women specifically recovering from heart disease. And the last one on that slide I just want to quickly touch on is the Australian General Practice Accreditation Limited. So they are producing really comprehensive educational and support tools through the Yana platform, which is an online platform working with Indigenous Australians and First Nations to get the support they need through that as well. So the other action plan that I want to touch on that we do have a fair bit of involvement in is just the National Strategic Action Plan for Childhood Heart Disease. So the plan identifies 3 priority areas, so management, care and support, supportive communities, and also research. So again, this action plan is available on our website. So this action plan was developed in conjunction with Heart Kids Foundation and also with funding from the government. So on this next slide, here's just a little bit about Heart Kids. So they're the only Australian not-for-profit supporting and advocating for families impacted by childhood onset heart disease. They have a broad range of educational resources and support options for those affected by childhood heart disease, both for the infant that's being diagnosed with the disease as well as the carers as well. So Heart Kids are dedicated to championing important research to deepen the understanding of those living with childhood onset heart disease. And there's a lot of great work going on in that space regarding promotional awareness, educational and support, and also development of videos and resources for those young ones that are actually diagnosed with heart disease, making that kind of understanding journey a little bit easier for those involved. So that's, I guess, a bit of a snapshot about some of the initiatives that are going on and the importance of research and how that research links to where we are now and all the initiatives that we're looking for and working on. If you do have any questions regarding what I've just gone through, our chronic disease policy at health.gov.au email address is on screen there. And also the MRFF at health.gov.au for other items in the webinar. So thank you very much for your time. And now I will hand back to Cindy.
Thanks very much, Ian. We have a little bit of time for our Q&A session. I'm inviting all the speakers who I thank very much for your presentations and to come online and answer any questions. Thank you for those of you who have posted questions in the Q&A section within the team session. I am going to read out the questions and then and one of the panel members will address them accordingly. So we've actually received 2 questions on a similar theme, specifically about the objective for Stream 4 of the Cardiovascular Health Mission grant opportunity, focused on what kinds of early prevention approaches or age groups would be considered. So I'm going to hand that question to Corinne Anglem.
Thanks, Cindy. So the objective of Stream 4 was determined by the EAP initially, the Expert Advisory Panel. And this objective that we've got in the grant opportunity guidelines is directly from the implementation plan. So applications to Stream 4 need to describe how they will address the objective of the stream and how the results of their research will lead to the desired outcome of the stream. So the merits of the proposed research or the proposed approach to this will be assessed by the Independent Grant Assessment Committee. So we encourage applicants to read the implementation plan, which will provide a bit of context, and this implementation plan is also provided to the Grant Assessment Committee. So yeah, I hope that's helpful.
Thanks very much, Corinne. Another question in the chat in relation to the grant opportunity. Is there $9 million total available for Stream 4? And that is, does that mean that only 3 grants might only be awarded across all 3 topics in this stream if each requests the maximum $3 million in total? I believe that's, again, a question for Corinne. So I'm going to hand over to you again, Corinne.
Yeah, thanks, Cindy. So in that stream, the top ranked application in each topic will be funded. And then if there is any leftover funds after that top ranked application in each topic is funded, then all the applications in that stream will be pulled together and then funded according to rank with that. So yeah, in short, provided there are, applications of good quality, there should be at least 1 application funded for each topic.
Thanks very much, Corinne. Now, there is a question in the chat around whether the slides and recording of will be available after the webinar, and I think it has been addressed by one of the organizers. Yes, they will be posted on the Department of Health's webinar and videos webpage, and there's a link provided in the Q&A section as well, if for those of you who are interested. So both the recordings and the slides will be available after the webinar. So just working out more, waiting for more questions to arise. I think there is one. Here we go. There's a question around the EAP composition. So can you remind us of the EAP composition, which I believe, and that is referring, if I'm correct, to the Cardiovascular Health Mission expert advisory panel that determines the priorities. So that is a question for Corinne again. I'm going to hand back to Corinne.
Yeah, so the expert advisory panel was ministerially appointed back in, I think 2020 or 2021. And the members of the expert advisory panel are listed on the Cardiovascular Health Mission website.
Thanks, Corinne. There's a question about the review. So I think there's a question about whether the Dementia Aging Aged Care Mission Review outcomes is likely to be released to the public. And for those of you who aren't familiar, it is another review that the department's currently undertaking. All missions undergo review in some form at some point. And so I'm going to hand that question to Maren.
Thank you. Thank you for your interest in that review. As Cindy mentioned, it is underway, and we expect that the report will be published in the Q3 this year, and will be on that same website that I linked in my slides. Thank you.
Thanks very much. Now, I think we're just working our way through the various questions, so just bear with us. I think there is one on. Apologies. Here we go. There's a question about whether the Australian Stroke Alliance is funded under the remit of the MRFF, or whether it is a separate source of funding, and if it's MRFF, is it part of the CVHM? I am going to hand that to Corinne, and perhaps other members of the panel may want, although other members of the panel may want to jump in as well.
Yes, sorry, Cindy, I might let others jump in on that.
So yes, Ian Edwards here again from Chronic Conditions. So yeah, there are multiple elements, I guess, to the Stroke Alliance funding. So from a chronic conditions perspective, government's providing $15 million for the kind of rollout and the implementation of that kind of pre-stroke care and the upgrades of ambulances and that sort of thing. So I'm not sure if there's someone online that could answer the MRFF side of it.
I can, I was going to speak to that, but I see there's a comment from the relevant section within the MRFF. I'm going to hand over to Fui. Oh, I believe Fui might not be able to speak. I'm very sorry, but Fui, if you are happy to post your response. And while Fui is doing that, I'll just mention that the Australian Stroke Alliance has received funding from the MRFF. It isn't intimately associated with the Cardiovascular Health Mission per se. It has received funding via a couple of MRFF initiatives, but we can provide more detail on notice, and we'll be able to get back to you on that. So I think it's great to see questions are coming up, and so just bear with us again while we get back to you. Now I think working through these questions. So under the review of the Cardiovascular Health Mission question 3, it was mentioned that there are 3 emerging priority areas identified by the review. Would you be able to repeat these? So I'm going to hand over to Marion for that one.
Thanks, Cindy. So these were 3 examples of priority areas that stakeholders and grantees had indicated as potential emerging priority areas. So the 3 examples that I read out, which were not the only 3, were basic and discovery research, primary and secondary prevention, and screening and diagnosis. So they just came from stakeholders that input into the review. They're still for decision for the department.
Thanks, Mirren. Another question, what happens if the top ranked project is, say, 500Ks of total available? Where does the spare 500K get directed if number 2 ranked is requested $1 million, for example? So I'm going to hand that over to Corinne.
Thanks, Cindy. The flow of funding with the various streams and the topics is all described in the grant opportunity guidelines. So it's probably good to refer to that.
Thanks, Corinne. I think, Corinne, you are the most popular question answerer today. Please apologize. The Q&A interface is a bit clunky, but we will have time. I think we've are at 2 minutes past the hour, and so we've tried our best to answer as many questions as we can, but if you've got any outstanding questions, please feel free to direct them to those email addresses that you see on the screen. We apologize that we couldn't get to them all today, but I just want to thank you all for attending. We hope that the session has been helpful for you in better understanding what the priorities of the CVHM are and how to apply for funding, how we improve and refine our grant programs, how cardiovascular research relates to national health priorities, and hopefully we hope to see a facilitation of better and eventual translation of research into health outcomes. So as I mentioned before, you can find a recording in the slides on the website. We'll aim to publish them as soon as we can, and on a whole as well. And you can also see the link for the currently open grant opportunity in the Q&A section. We do strive to be better at communicating to researchers on these issues across our grant program, so do look out for future webinars. You will find other webinars that we've published previously as well on the link that I just mentioned. So thank you all again for attending, and I wish you a good rest of the day. Thank you to our speakers, and thank you everybody.